Renato Steiner has bone marrow cancer. He's going through intense treatment that often means weeks at a time in this Sao Paulo hospital. But in many ways, he's fortunate that he was diagnosed early and can get good treatment.
Se não tivesse plano de saúde, o tratamento seria muito caro.
If I didn't have private health insurance, treatment would be very expensive, and I would not have the means to afford it. It would deplete my savings, and for my family, it would also have been a financial burden.
Acabar onerando também a família.
Renato is likely on his way to recovery, but many patients like him aren't so fortunate. Cancer mortality rates in Latin America are little more than 50%, almost double the rate for European countries and the United States. In Latin America, the ability to treat and diagnose cancer is lagging behind.
Eu diria para você que nós podemos curar cerca de 90%.
We are able to cure close to 90% of cancer cases if there is early diagnosis and correct treatment. In developed countries, there is usually the conditions to do early diagnosis. But here in developing countries, in Latin America, that is often not the case in many areas.
In big cities like Sao Paulo, there are world-class cancer centers, but that is often not the case in smaller cities. Solange Nogueira needed treatment for breast cancer. She had to sell her house to pay for her continued flights to Sao Paulo to get treatment.
In my home state, there's no radiotherapy, only chemotherapy. When I had to do radiotherapy, I had to travel to Sao Paulo several times.
The Brazilian government is taking steps to try to treat patients sooner. President Dilma Rousseff recently signed into law a new regulation that would force all public hospitals to start treating cancer patients within 60 days of diagnosis. They've also set aside over $250 million for new cancer treatment centers in areas of the country that need them the most.
But the studies show that by 2020, the number of cancer cases is expected to increase by more than 40%. Renato is hoping to beat the odds soon and to become a cancer survivor in a part of the world where that's often not the case. Gabriel Elizondo, Al Jazeera, Sao Paulo.